Welcome to the 503rd episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Welcome and thank you for listening. Next week is the long haul 100-mile race. Going to be there. Going to get to the starting line. That was the first step of the mission. Next step of the mission is to complete the long haul 100. Talk more about that later, but we have the same crew and pacer. Michael will be running this year the full way around. My mindset coach, Susan Donnelly, will also be there running. So, and of course, Andy Kroom is the race director, so it'll be a fun time. I hope. I'm also pleased to announce that the Leadville entrance list came out, and I knew it already because I had deferred, but I am in for the Leadville 100-mile race as well as the 50-mile Silver Rush race this year. So back to Colorado in the summertime. So this first race in Long Haul 100 is going to be testing grounds to see how the old ankle is healing up and holding out. More and more data is coming out that when we have tendon or ligament or soft tissue injuries, that weight bearing is essential for healing. Weight bearing increases the load to the joint, the tendon, the ligaments, the cartilage, and increases blood flow. And we need to have weight load even more than our own. And I do believe that the strength training that I have been doing 2 to 3 times a week has really helped to improve my ankle, and I can feel things getting stronger and continue to work to get things as strong as I possibly can so I can climb those mountains out in Colorado. Yesteryear, an ankle injury, sprained ankle, small fracture in the foot would put people on the sidelines in a boot. People that have tendinitis, put them in a boot, give them steroid injections. That is no longer in favor. Again, weight bearing and exercise. So certainly walking as much as possible to start with, and then increasing load bearing. If you're a runner, you can start running. You may have to back off on the duration to tolerate, and you just have to see with recovery how much your injury tolerates. But it is very important to load the joint, to not just put yourself on the couch along with your affected tendon and hope that it'll get better and you can start from square one, because you're deteriorating at that point. Your muscles are weakening. You're losing muscle mass, and you're also losing blood flow to those areas, and it just is not a recipe for a good outcome. So hopefully I'm coming back stronger than I was. Again, I continue to increase mileage. I had my biggest mileage last week, and my ankle is taking it. Does it get a little sore? Yeah. Do I have some aches and pains? Yes. But I continue to recover, and after I come in and stretch, the next day I'm ready to go again. So I'm very confident that, it's going to hurt a little bit, but I think it's going to take me through the 100 miles. My plan for ankle discomfort is to troubleshoot, just like I'll troubleshoot with anything else that should happen: fatigue, being cold, GI distress. It's what can I do to change things? And what I've noticed with my ankle is, changing the way I hit, changing my gait. Sometimes just the anticipation of pain can make you tighten up or not have good form, and it can actually exacerbate it. So the first thing I do is look at my running form to make sure I'm not kind of trying to protect the area that's having discomfort. Perhaps if the angle of the ground is shifted one way or another, I can change sides of the road or trail to give myself a little bit of relief, change gait, stride lengths, again, how I hit, cadence, and then nutrition is a big part of it, because when you start to go through your nutrition and deplete glycogen stores, everything gets depleted, including your tendons, and the weakest link starts to show up first. So it's going to be a good warning sign for me to make sure I'm on top of my nutrition and hydration as well. And I think that can be translated to people starting a health journey, or perhaps people starting to walk or starting to strength train. Oftentimes we're afraid of getting injured, we're afraid of discomfort, we're afraid of soreness, or maybe we even have a nagging injury, plantar fasciitis, or a history of a tendon or history of knee pain, and we baby that area or avoid doing things because it hurts a little bit, but it really doesn't do us any good. The question is, why is something not behaving correctly? Why is a joint hurting? Why do you have plantar fasciitis? Why are these things occurring? And just aging and playing basketball when you were 12 are not good answers. You can recover and build at any age. So the question is, what is going on, and what do you need to do to fix it, and what kind of load to that area is best suited for you? But I come back to the point where a little discomfort goes a long way into helping people to grow, both from a troubleshooting view and a mindful view, and we're stronger than we think we are. You're always going to have aches and pains when you do physical exertion, but not to do physical exertion means your body's going to continue to decline at an even more rapid rate. You can lose 8% of your muscle mass per year if you don't do anything, which can add up very quickly as you get older. Even when I was training for marathons in my early 40s, I would be stiff and sore. Less so after I became plant-based, but you would be stiff afterwards, and you go about your day, and the next day you were better again. Same thing happens now. I may have aches or pains, but that's kind of part of the process, because a few aches or pains here or there is nothing compared to what I gain in muscle mass and mobility and mitochondria and functional use of my body. Even if you have a very, very fancy car and you just keep it in the garage because you don't want to wear it out or you don't want it to get dirty, it tends to deteriorate. In Florida, it's kind of a joke if you have shoes with rubber soles and maybe you saved them or in the box on the shelf and you haven't worn them. Sometimes you can pull them out and they've deteriorated even though you haven't even worn them just with time. Things oxidize, and your body will too if you don't use them. So saving yourself doesn't result in things getting better. I have worn glasses to correct my distance vision since I was in my 20s. It started in medical school and college when I was reading more. My ability to see far deteriorated, and it resulted in me wearing glasses. And I wore contacts, and do wear contacts most of the time. And as we get older, our ability to see close starts to deteriorate a little bit, and it can play with the distance vision as well, but the need for cheaters. And some of the ways to correct all of those things are to wear what they call monovision contacts, where you have one contact that you use for your distance vision and one contact you use for your close vision. And it's kind of a quick fix that your brain will adapt to allow you to have maybe the best of both worlds in some respects, but there's always a drawback. And the drawback with monovision is that you lose your depth perception. And a few years ago, wearing monovision contacts, I did not realize my depth perception was off until I started doing trail running and end up falling 4 or 5 times in a race over routes that I did not see coming. I would just end up with my face on the ground, wondering how that happened so quickly. And it didn't take me long to say, this monovision thing is really causing a problem. I need to fix it. Unfortunately, my eye doctor passed away, and so I regretfully opted for a quick fix and went to a Eyeglass World type establishment and got an eye exam and fitted for multifocal contacts. The good news about the eye exam, is somewhat automated in these places, but they took pictures of my eyeball and I got to see them, and my retinas looked good, my eye looked good, the pressure in my eye was good, and they came in and I asked for monovision. So I knew what I wanted when I went in, and the doctor was not real receptive to the fact that I was a runner and really needed depth perception. He saw my gray hair. He had gray hair as well, and said that, it's a compromise and you have to decide whether you want to see close or you want to see distance, and you're going to lose a little bit of both, and that's just about as good as it can get, and try these contacts. So I went, and he said if it just wasn't good, there was one other thing that they could tweak, and I believe they gave me 2 different ones to try. So I went home and I tried the contacts, and I believe that I found the one that I liked, and so I called them and I had them order me the multifocal lenses, and that was that. It was an improvement because it fixed my depth perception, but it was a significant compromise with distance and both close up. So I lost some close up and I lost some distance, and over the past year and a half, my right eye seemed as though everything was getting worse, distance and near vision. So I was a little bit concerned because it seemed it was my right eye which was the worst. And I did a little experiment on myself, and I put 2 of my left contacts in, so my right eye had a much stronger prescription than I'd ever had in it, and I was maxed out on the strength of the close vision in the multifocal vision. So I couldn't get any stronger ones as far as the close goes. And again, the distance was pretty strong in the right eye. So I decided to see what would happen if I used 2 left contacts. So it went down in distance strength and stayed the same on the close strength. And lo and behold, I could read again. I could read close up again. And it's like, hey, I'm on to something. And meanwhile, I made an appointment with an eye doctor that I trusted, and went to see them today, and, fessed up at what I had done, that, went with 2 left contacts, and I got an eye exam, and turns out my distance vision, both in my glasses and in my contacts, was grossly overcorrected. So they were way too strong for what I needed. And it was a relief, because I thought, geez, my eyes are getting, I'm starting to get bad eyes, and, wonder if I have anything else going on. And so the pressure in my eyes look good. I don't have any cataracts. The blood vessels in my eyes look excellent. And my eye doctor is plant-based as well, so he was happy to see that. And we talked about all the changes that he sees in the retinas of people coming in that have multiple risk factors and have a traditional standard American diet. But nevertheless, he was able to markedly decrease my prescription, and my distance vision actually is back where it was 20 years ago. So that's pretty cool, being plant-based. And so I have a little bit of astigmatism, so that's the way my eye is shaped, and he didn't think that the multifocal lenses were really going to be good for me, especially with the computer and the blue light and things like that. And so he gave me a prescription for a different contact, and I'm actually wearing the same strength contact in both eyes right now, and I got rid of the multifocal. A multifocal lens is like a bullseye lens. It has a bigger hole in the middle for distance, and then the surrounding rings help you to see various close-ups. So it's kind of like a progressive lens, so to speak, and your eye and your brain, or the light is supposed to be able to be close up. And it just wasn't working out for me because of the way my eye was shaped. I was losing my close vision. So anyway, he was able to put me in contacts and glasses that were much less strong. And I can actually I can see my watch, and I can see things pretty good close up. Probably need a little bit of a cheater during the day with a computer screen if I want to, but for the most part, much improved. So, again, plant-based diet, we don't often talk about, I actually never talk about eye health, but it is very important because risk factors for other diseases also are the same risk factors for retinal diseases. So cataracts are more common in people that Smoke, more common in people that are overweight, fatty liver disease, diabetics, and exposure to UV light or blue light. And that's where there comes some controversy as far as light and health, because near red light is actually very beneficial to your eyes. So morning sunlight is very good for your eyes. Afternoon sunlight that has more UV, blue and violet, are more harmful. Red light is in the category or frequency of 670 nanometers, where blue, violet lights, harmful lights, are between 200 and 480. And those can hurt your retina, your cornea, the optic nerve. In addition, people are all worried about being outside in sunlights, but LED lights are also not good for your eyes either. So we're not doing ourselves favor with LED lights everywhere. There is some data that 3 minutes of early morning light exposure, because it's more of the near red, can actually improve vision and decrease retinal damage. I learned today in my research that actually the eye the eye is the richest source of mitochondria, and the eye has to use the mitochondria to process energy and ATP. And as we age, that ATP production, because of lack or decreasing mitochondria, actually starts to go down, and it's one of the reasons for retinal damage and decreasing vision. So people that have metabolic diseases such as diabetes, and again, being overweight and inflammatory conditions or anything that causes loss of mitochondria, may experience worsening eye function. And just getting your BMI under control, getting rid of your diabetes, is a very, very important thing when it comes to your eyesight. I read a study today looking at the aorta and stiffening over time with regards to regular exercise. And the title of the article was De-Stiffening Age of the Aorta with Regular Aerobic Exercise, Fact or Fallacy. And it was from the University of Iowa, and they looked at how many days per week that's associated with improvement in aorta stiffening, both in people with hypertension and people without hypertension. When the aorta becomes stiff, so the aorta should be very compliant, like a very soft tube, that when the heart blood goes into the aorta, and the aorta actually dilates, and then it relaxes, actually somewhat like a balloon. So it expands and contracts. But as we age, calcification starts, endothelial dysfunction starts, and the artery becomes very stiff. In people with stiff aortas, they typically have high systolic blood pressures and low diastolic blood pressures. Obviously, when the aorta becomes diseased, there's also a risk of aneurysm development and or dissection, where the lining of the aortic wall splits apart, and that carries a very, very high mortality, especially if it's in the chest. So they looked to see whether or not this aortic stiffness was a predictor of cardiovascular death and disease, and they looked at the difference between the carotid and the femoral as far as a pulse wave velocity. So if you want to think of waves, the waves from the top of your neck to the top of your femur or your artery in your leg is basically how far and what velocity that travels, depending on the stiffness of the artery. So a 1 meter per second rise in this pulse wave velocity was associated with a 14 to 15% increased risk of cardiovascular disease and death. There was also noted small vessel changes in the brain and cerebral blood flow. Organ damage in brain, kidney, even the retina, as well as white matter, leading to decreased cognition. So this would be yet another reason for dementia. What they found was that regular aerobic endurance training, so prolonged walking, running, was associated in middle and older age groups to maintain the aortic valve compliance, and the stiffness did not occur despite people aging. This was true in the group of people that did not have high blood pressure. So once high blood pressure started, it was much harder to reverse the aortic stiffening that had occurred. But if somebody had the development of aortic or aorta stiffness and they were to start an endurance program, they could actually reverse it. They looked at an aerobically active postmenopausal women, mean age of 59 versus premenopausal mean age of 31, who ran 6 hours per week and did regular endurance events for 2 years all the way up to 13 years. And they found that the older aerobically fit women had the same aortic valve compliance or aorta compliance as young women, and certainly much better than their sedentary counterparts. And this held true even if people had risk factors for vascular disease. This didn't translate with resistant exercises, so this was an endurance training such as running. What they found in people that did not have hypertension, that exercising greater than 3 times a week for over a year was needed to significantly decrease the stiffness in previously inactive adults. They found the lowest amount of aorta stiffness in committed exercisers that actually, and masters athlete that ran 6 to 7 days a week. If endurance training was adopted and it continued, the risk of decreasing blood pressure elevations decrease, and you could actually reduce blood pressure as well as decrease the stiffness. Restriction of salt consumption. So we aim in our practice 1,500 to 2,000 milligrams a day. Also has a benefit on aorta stiffness. But the bottom line is once hypertension has developed and once the aorta stiffness is much harder to reverse. But it can be done. The other thing is that blood pressure medicines don't make any difference in aorta stiffness. So we can treat a number and we can bring the blood pressure down, but we don't change the pathological changes that are leading to the problems, as noted many, many times before on this podcast. Bottom line, there is no substitute for endurance aerobic cardiovascular training for your aorta, for your eyes, for your blood pressure, for your mitochondria, and your overall health. So check out our programs to get you running, sign up for a 5K, 10K, and get training. If you'd like us to help you in this new year, we would love to participate. Go over to drdulaney.com and check it out. And there's many ways for you to join our practice and join our wellness group so that you too can decrease your aorta stiffness. We got a call today from somebody that their medications went up in price. They changed insurance plan, and the people getting their insurance, working with them to change their plan so they could save money on their premium. And this is a supplement, so this is Medicare plus the supplement. Working with somebody, and they said, we're going to change you so much money a month, but it ended up costing them more because they were on prescriptions, and the prescriptions weren't covered, or their deductible was higher. And if you're in the process of changing insurance plans, be careful to do that and make sure that your medicines are covered, because there are games that are played between the pharmaceutical industry, the pharmacies, and brokers and mail-aways, and the patient is not who wins this battle. It is the corporations that win the battle. And the best thing that you can do is to get off of these medications so you don't have to play. Some medications people can't get off and they're necessary, but most people can half their medicines at least at any age. So that's the first thing that I would suggest for people to work with their physician or our group so we can help you get off of your medications. Most doctors, once they put people on medications, have no intention of ever taking them off. And most medical practices have no interest in looking for what's the cheapest medication for your plan. They're going to look what they have in the back, or who brought them lunch, what pharmaceutical person brought them lunch, and that's what they prescribe. And a lot of times people don't care up front because they're given these little credit cards that they have their deductible waived for the first year or the first 6 months or maybe the first 3 months, and then all of a sudden comes down, blowing down, that they have to pay this big deductible for these medications. The other thing that happens is that when people go through in Medicare and their medications, there is a donut hole, and when you're prescribed a medication, the retail price of that medication goes towards you going into the donut hole, not your discounted price. And oftentimes people just think that their copay is what goes into that, and they end up in the donut hole much quicker, so they have to start paying full price for their medications. Not to mention the fact that some of these medications that, again, lifestyle changes can thoroughly reverse are tens of thousands of dollars per month that people are just going to be falling into the donut hole or falling into the debt because they will not be able to afford these medications. And most of these medications do not treat the underlying condition. They treat a number, they treat a few symptoms. They all 100% all have some back-end side effects. So how can you start in the new year? If you're new to plant-based nutrition, greens are the biggest bang for your buck as far as medicinal value for a food source. So things like cabbage, arugula, beets, kale, broccoli, cauliflower, collard greens, mixed with the bacteria in your mouth and the amylase, and your body produces nitric oxide that dilates your blood vessels, including your aorta. So I am very sure to include some sort of greens in both my lunch and my dinner every day. And I mix and match. I will tell you that people that rely solely on spinach because of its high oxalate count can get kidney stones. So mix your greens. If you don't like kale, try cabbage, romaine lettuce, arugula, any of those, but mix them up. People say they get tired of salads, but they need to be more creative with their salads. My lunch salad today was kale, and I like to chop it up fine. It's a good way to practice chopping. I buy loose kale, strip the stems, chop it into to a fine piece, and then I massage it with a half avocado and the juice of a lemon. Then I added beets, celery, peppers, a little nutritional yeast, and for a little extra protein source, I microwaved a bag of edamame. And I think they have like 16, 17 grams per bag. So that was about a 20-gram protein lunch that was heavy in antioxidants, heavy in nitric oxide-producing greens. At dinner tonight, I had a combination of arugula, sauerkraut with mustard, peppers, and I used a dressing that was mustard, yogurt, almond milk-based yogurt, and a little nutritional yeast and a little oregano and garlic. Makes like a Caesar dressing. I also had some sprouts that I grow. Sprouts are really also good bang for your buck. They're easy to grow in a mason jar on your counter. I grow mine and just keep it sitting right in my dish drainer. You can get organic sprouting seeds off of Amazon or any company, put them in the jar, rinse them every day. In about 4 or 5 days, you've got nice green sprouts that give a crunch to your lunch, salad or dinner salad, or even on top of soup. So it's a good way to get extra nutrients that don't take up a lot of space. So those are two good different ways to make a salad. I use what I have in the refrigerator. So this is towards the end of the week. So I needed to go to the store tonight. They didn't make it. But usually I have cucumbers, peppers, carrots, celery, some sort of greens, tomatoes, to choose from. And Sometimes it's just vinegar, but sometimes I like a little different dressing, and sometimes I like to increase the nutrients of it. My mileage is really high. I'm working out, so I'm trying to get a little extra calories in here and a little extra macronutrients in the couple of weeks coming up to the race. So in summary, there is not a pill out there that will reverse the stiffness of your aorta or improve the vasculature in your retina. It all depends on what you eat and how you move. And moving is extremely important. So start with a goal and adjust your diet in steps and keep adding on. Sign up for a 5K. It's the best thing that you can do. Most local 5Ks don't have a time limit, and you can walk it and start from there. I have an 89-year-old member of this practice that we're so proud of, that she does 5Ks at least once a month. So if she can do it, so can you. Get out and move. If you have a few aches and pains, probably going to get better. You might get an ache or pain someplace else. If you'd like us to troubleshoot those aches or pains, we can fix them without steroid injection and medication. I've been doing this long enough that I can troubleshoot most anybody's running injury and get you on the way to better health. We also have the ability to give you a strength training program with our famous university-trained coach Nathan Meinerich. We have a registered dietitian on board to help you clean up your diet. So go on over to drdulaney.com and sign up for our practice, and let us help you get fit in 2025. Thanks for listening. Share this podcast with your friends. Thank you for taking a look at our website.